So most of you have done the installation. Something that I want to let you guys know is that you need to have these two files, Autodoc and Autodoc Grid. These are the executable files, and you need to have them in a working directory in the place wherever you are going to decide that you're gonna have your ligands. So you need to identify where are these, and these are located once that you have installed the software. They're going to be in my. You go to PC and Windows and program files, and there is a folder called the Scripps Research Institute. I have a question. Which one is the docking directory? The docking directory is where you are going to have all your files. You can put this docking directory in your desktop, in your documents. For example, let me show you. So here, this is my computer. So I have in my documents, I have here wherever I'm working in the scripts, and here I have a folder that says docking. Here I have, this is going to be my working directory. So I have the name of the ligand here, indazole, and here I'm putting all my files. So in this working directory, you need to have Autodoc and Autogrid. So that's going to be, you can put this anywhere as long as you know where is the location. I want to just to start with a brief introduction. I'm guessing that most of you are very familiar. So why are we doing docking, and what is first what is docking? Docking for me, what is docking? When I came to the United States, I heard the term about docking, and I was not related with the term about docking. To dock something in Spanish es como anclar, como un puerto cuando llega un barco y lo anclas. So docking is to dock something. So you're gonna have a protein, your target protein, and you're going to define in a box. So this is a box, a 3D box. You're going to define the active site, and you are going to put a ligand. So the question that we're trying to do is, where is this ligand going to sit in the protein? So this box, you're going to define the box. You can make this box as big as you want, but that's going to require more computer time, right? More calculations. And the idea is to predict if this molecule is going to bind to this protein. So once that you do it, so this is docking, this is the little box. You have the entire protein here, and this is the little box that you're going to define. Then we are going to do this tool that is called Autodoc. And if you look at these ligands are dynamic, so they are going to you're going to identify what is the best position or where this molecule binds. So in overall, this is what is docking. And there are different variants. Some people also, because these molecules are not rigid, or the protein is not rigid, then is when we also use other tools that are like, for example, as molecular dynamics that you're gonna see with Carlos and Jesus. So that's overall what is docking. Why do we do docking? Why is important for us to do docking? In the process of drug discovery, in overall, a very general term, general process is that you need to identify your target protein. In this case, for example, I work with a protein in my at the scripts, that is a tumor suppressor. It's a protein that is a vital protein in a function. So this you can name it any protein that you want. So first you have to identify your target protein. Somebody has to already to crystallize this. So if this protein is already in the PDB, that means that they have the structure of this protein. Then you have, through a process that is called high throughput screen, you're going to identify small molecules that bind to the active site of this protein. And this process is called hit identification. So you need to find something. If you look at this molecule, this red one, binds to a specific site of this. This is the active site, has 3 parts, right? 1, 2, and 3 in the surface. So you here identify one molecule that binds to one part of the active site. This green one binds to another part, and this one on the top. So once that you have this, we call them hit leads. You can do different things. For example, in this case, we're going to do something that is called fragment growth. Vamos a tomar un pedazo pequeño y lo vamos a hacer crecer. So we're going to do fragment growth based on an initial hit. Or you can do, for example, fragment merging. Now they are combining the pink, the purple, and the red fragment, and putting it together, right? So they're finding 2 possible hits and then trying to put it together. So once that you have done this process, you have to perform tons of biological analysis. You have to make sure that this molecule doesn't harm your body. What are the effects, the secondary effects? We also worry about the solubility of the molecule. If this molecule has to be taken oral, injected, if it's going to be digested by your stomach acids. So we have to do tons of this analysis. And after that, after passing this process, you end up with few molecules. So you start with thousands of compounds to end up with only 5 or 6 candidates. And after doing all these things, you go to the phase that is called preclinicals and clinical trials. Somebody has a question. I cannot see it. Oh, here. How do we know what is the active site? Usually we have the crystal structure of the protein. Otherwise, it's going to be hard to you have to do some type of identification, a process of identification, because you need to know exactly. So once that we go to this phase, the clinical trials, this is going to be tested. Now here, for example, we are seeing in real time in the United States because we are testing a new drug, a new vaccine in real time, and we want to make sure that this is going to work. So all this process of drug discovery, as you can imagine, take years of process. So you don't want to go to this stage after 10 years, 5 years. You don't want to go to this stage and that the molecule that you created fails, that doesn't work, right? So in this cost billions of dollars. And there are famous cases of molecules of drugs that just fail the clinical trials, and you have to start all over again. So this
there's a question, Gabriel.
Question: what is the difference between hit and lead? You can have several hits. You can have several molecules, and lead is the one that you're going to use it because you think that is the best candidate. So a lead is a leader. So, el mejor candidato. So, puedes tener diferentes moléculas, pero el lead es el mejor candidato. So, because these compounds or this process can take several time, this is costly, and this is we don't want that, right? So a better way to do it, or a way to try that without having to pay this high price, is using docking. So docking, you can do it from the commodity of your home or your house. And the only thing that you have to pay is time. You have to try different compounds. So that's the advantage of doing docking. And just to put it that what is this, I went of what is docking, just to give you an example in real time of what how is this important, or how can you use it. I brought this example. This is a preprint. Now preprints are very preprints on artículos preimpresos. So these are articles that people upload for other scientists to judge before going to publication. So you can get different comments from other authors. So this article was published, or was uploaded by a friend of mine. This is Kushbu. She was with me in the PhD, and she used Autoduct, the tool that you are going to use, to identify existing drugs against the coronavirus. Imagine that in March we had this pandemic, and everybody was just going crazy. It's like, what are we going to do? How can we stop that, right? So designing a new molecule, as I mentioned, designing a new molecule is going to take times, right? Years, and it requires a lot of process going through all these clinical trials and phases. So what they thought is that you can use molecules that are already in the market. You can test if an aspirin, or any molecule that has been already approved, or has passed through all the process. So the question was, does existing drugs that have been approved for clinical trials can inhibit the main protease of the coronavirus? So they based on that, they did docking, as what you want to do today. And they rank based on these results. They ranked these results in scores, and they predicted that several molecules could have an effect on preventing COVID-19. So to me, that's really cool, because you probably could have done it also from home, and this is a real application, or something that you can imagine that you can be doing later. So this article, it's free. I'm gonna post it, or you can find it. You can find it there, but I'm gonna make a folder also. Now, what is my idea is that you guys learn by doing it. So I want you guys to be able to follow while I'm presenting, and we can stop and make sure that everybody's going in the same pace. So what is the general overflow of Autodoc? So first, you have to we know the you have to know the receptor and your ligand. You have to first we're going to prepare the ligand. Then you're going to make sure to define the torsion angles. That's making sure that, for example, we're going to do fragment growth, or growth fragment. And you have to define which angles are rotatable or not. And we are going to save this file as a Pdb Qt file. We're going to start with a file that is a Pdb file, but we're going to add the Q and T, because Autodoc it doesn't recognize or needs to have this type of file. The second step is going to prepare your receptor or your protein. So we have to remove water molecules, ions, salts. You have to remove other things that were used in the process of crystallization. So we have to remove the ligand, and we have to add hydrogen bonds. And then later, we are going to save this as a PDB Qt file. Then you install two files. One is the grid, AutoGrid, and the other one is Autodoc, and something is missing here. So you want to, you have to generate these grid maps. The grid maps is just the box that I was talking to you. This grid map is this little box that we're going to create. So we're going to do generate the grid or la cajita, and then we're going to run AutoGrid, and I'm missing something here. And the last step is to run Autodoc. And finally, we're going to analyze our results. How are we going to do it? All this information that you're going to do is based on a scientific article that was published in the Journal of Chemical Education. And the idea for me to choose this article is that you can go back anytime and find this information available, and you can check your results, or you can share it with your friends. This is a workshop that was used in the Northern Illinois University. So you can find this. I also going to add this article in a folder. But the idea is that they use a protein that was already crystallized and that went through the process of fragment growth. So I'm going to explain. They use a protein that is called cyclin dependent kinase, or CDK2, to design a new drug or a new inhibitor. And this is the process that they went through. So they started with the identification of a hit molecule. This is called indazole. So indazole, they find through a high throughput screen, and this is just to reference this. This is the first part. They identify several molecules. They did this part, and they came out with indazole being the best or the lead molecule. So these molecules, they measure binding, the affinity, la afinidad del sustrato por la enzima. They measure this binding affinity, and this is, we call it IC50, and this is measured in units of concentration. The smaller the number, the tighter the binding. So that means that more binding or is a better inhibitor. The smaller the number, the better the inhibitor. So they first identify indazole, and the rationale was, or the thinking was, that by adding other molecule, you can form some interactions of the active site. So by doing this, they're doing this part. They're forming more interactions. See, now you can see how by adding this part, they increase the binding affinity. So they went from 185 micromolar to 3 micromolar. So this is a very good inhibitor. Then they thought that if you can add more molecules, there is more space in the active site. You can increase the affinity for the ligand. So this was cool, right? And then finally, they were wondering what happened if you remove this ring from here. And when they did that, they found what happened, that the affinity went up again. So that was not good. So then you want to go down and down. This is much better, because that means that you have to give less drug or less of the medicine to inhibit this molecule. Otherwise, you have to give, it's like if you have to take, what is the, I have my pills here. Acetaminophen is, I have to tell you to take 5 pills of acetaminophen, right? So that's not good. Or aspirin or something like that. So you want to have the smaller number. So all this information, it is here in this article. And so they went through 4 different stages. So they did this part, fragment growth. We are going to do it. We are going to practice with indazole, and then you can learn, practice, and do it with the other ones. I see, Eduardo, you have a question, right?
Yes. I was wondering, how did they decide that they wanted to add this specific chemical structure? Like, is it an algorithm? Is it you look at the surface and try to think what could interact better? How is it?
Yes, that's correct. So what you're gonna do is that you look at the, after doing the docking, you see there are 2 different positions, right? There is the blue one and the red one. So what you want to, after looking at the, doing this analysis, you find that, for example, this is a nitrogen that could be forming a hydrogen bond with another residue in this site. So you have this, all this is based on the structure. So Jesus had yesterday, all these drug designs is based on the structure base. So we have to know the structure and the position of the ligand. So, and like you say, here they found, for example, I have it here. So they found that first they started with indazole. Need to. They thought that if you add this molecule is near to 2 residues that could be form hydrogen bonds. So they say let's add some amides here that you can form hydrogen bonds with this oxygen or this nitrogen. And that's basically, that's what they're doing. Exactly, they're just looking at the structure. Then they came up with this new molecule, and then they say, okay, there is more room to put this sulfamide, because we can form more hydrogen bonds with other residues, aspartate 86. And then they say, okay, let's add this one, and then it works. It could happen that you add them and it doesn't work. So yeah, that's the main rationale. And then finally, also they tested the last part. They said, now what about if we don't need this one? And then they remove it, and they found that it's very important. So also, I'm not a medicinal chemist, but we think, oh, it's easier to come up with these molecules, right? But these molecules have to be produced by someone that is a medicinal chemist. So they have to be synthesized in the lab. So all your organic chemistry or inorganic chemistry have to work. And sometimes it's not hard. It's very hard to come up with these molecules. You can say, oh, I'm gonna put this other ring here, but it's not that easy, right? So it's very complicated. So so we're going to go through to start. We're going to, I want you guys to follow me. I want you guys to be able to do it while I'm doing it. So if we have questions or we get stuck in the middle, so you have to do it. Otherwise, it's going to be just a lecture. So you have to practice, and I want you guys to start doing it so you can remember and you can practice. So the first thing that we're going to do is to prepare our ligand. So what I'm going to do, I'm gonna just show you here, and then then you're going to do it. So first we have to prepare your ligand. There are 3 different ways to prepare a ligand, and I try to use resources that are free, that you don't have to pay, nobody has to pay. And the main one is that you can use your ligand directly from the PDB. I'm gonna do it in a second. And other ways to do it is that you can use other resources like PubChem, that you can download the structure and you can convert it using other softwares that are open source, but we are not going to do it. We are just going to download it directly from the PDB file. And the third way is that is something called SMILES. It's also from the NIH. So this is a National Institute Health. And there are free softwares that are just available. So you can draw your molecule directly there and you can convert it into a PDB file. But we're gonna go through the easiest way. So what I want you guys to do is to download the structure, this ligand. I don't know if you have done it. In the way that we do it, I'm gonna open my my browser here. So you're going to go. So first, the molecule that we are going to be working, the 4 letters code yesterday I showed you is 2-BTA. So if you want to write it down, if you search in the PDB for 2-BTA, at the bottom of this website I showed you yesterday, there is a lot of information. At the bottom of this website, you can find that this molecule, CDK2, was co-crystallized with 2 ligands, small molecules, 2 ligands. And for the ligands, we give 3 letters code. So for proteins is 4 letters, for ligands is 3 letters code. So we have the ID for this indazole. And can you, am I sharing my screen? Yes. Can you see it? Yes, right? Yeah. So you have indazole, the 3 letters code is LC1, LZ1. Also in the structure, they use glycerol, and glycerol has the 3 letters code of GOL, GOL. Glycerol is there because it helps in the process of crystallization. So once that we know this 3 letters code, we have to download it. And to do that, we go to the PDB. You search for PDB Ligand Expo. If I go too fast, just stop me and say, "Hey, Gabriel, wait a minute." So you go to Ligand Expo, and then here you type search. And here we already know the name of the ligand. So LC1. And then you click go. Now there are tons of file options that you can download, but we need to download this one that is called PDB format. This is, as I mentioned yesterday, is a file, it's a Word document. So you need to download this one. And it went to my downloads, and it's going to try to open it for me in Word. I don't know if you guys can see it. No, I don't think so, but you have to download that, and then you have to put it in your folder. I'm showing you here. I'm gonna create a new folder here. So I'm gonna start over from 0 here. So I'm gonna make a new folder. And I'm gonna call it indasol underscore 1 or indasol 1. I already downloaded the molecule ligand. This is the PDB file. I'm gonna copy it for the ligand. So we have indasol, and you need to have, as I mentioned it, you need to have these two executable files, Autodoc and Autogrid. So copy them. So this is what I want you guys to have right now. You need to have a folder. Do not put spaces in the name of your folders. I'm telling you because I have done it, and the program doesn't like that. Doesn't run. I don't know. It's Python is what doesn't like to read spaces. So I want you guys. I'm gonna stop there, and I want you to make sure that everybody has Autodoc and Autogrid. Good. Yep. All right. Now we can go ahead and try to put the name of the protein there. So let's do it. Let's do it that now so we can download it. So go ahead and also from the PDB download the PDB file of the protein structure. So go to your, I'm gonna go here. Go to your PDB, type 2VTA, and download the file in PDB format. And I want you to download it and put it in the folder that we're going to in your working directory. So please do that, and I'm gonna put it there too. So you're gonna have your structure, your protein, the 2VTA, Autodoc, Autogrid, and in the solder. Where do we get Autodoc and Autogrid? Autodoc and Autogrid. Let me share the presentation. Those once that you install, I put it here in the presentation, and you go to your PC. In this case, in my PC, then you go to program files, and in program files, there is a folder. Program files. There is a folder that is called the Scripps Research Institute, and then you have to copy these ones and paste them in your working directory. Great. Okay, so now we have all those 4 things there. What is program files? Program files is in your in PC, Windows, and in my case is in my case is here. PC, Windows, program files. Why didn't we get the glycerol? Yes, because we are going to delete the glycerol. But that's good that you remember. So is everyone okay? Yes. Yes. Okay. I'm seeing the faces of some of you, and I think if somebody say I'm not or I'm not ready, just stop me. PDB format, experimental model coordinates, or PDB ideal coordinates. PDB format, ideal coordinates. All right, now we are going to open Ariana, okay, thank you. We are going to open NGM tools or Autodoc. So to do that, I'm going to share my screen. Going to share my screen, sorry. So I'm here in my desktop. So I'm going to open Autodoc. So open your Autodoc Tools. I cannot see the chat.
So, there was a question if you should pick Pdb format experimental or Pdb format ideal coordinates.
Ideal coordinates. Thank you. So we opened this and it's not going to launch immediately, but you have to say remind me later. So you click there. Don't register now. You can do that later, right? And then while doing that, you're going to open Autodoc Tools. So you can start. This is basically a graphical user interface. If there is, I think Jesus has done docking without using this interface. So there are ways to do it without. You can just start typing your codes and you can use a Python script and you can do it. But this is also very helpful. So the first thing that we have to do is to set up the working directory. This is very important because otherwise it's not going to work. So you're going to go to File, Preferences, and Set. File, Preferences, and Set. Now this is going to open this new window, and there is going to ask you, where is your startup directory? Now I want you guys to go wherever you have set up your directory and copy that direction. So in this case, I have it in this PC, documents, docking, and Indasol, and I'm gonna copy this. I'm gonna click there and copy and bring it here. And you can delete this one here and copy there. So I put it here, make default or set, and then you click dismiss. Good? Yeah, okay. So we have to do that. Now we have to prepare your ligand. The first step is to prepare your ligand. So we're going to go to ligand, to this tab. There goes in the steps. So you go to ligand, grid is for the protein, then docking is to prepare your docking run, or your grid, and then your docking to run your programs. To run your programs and then to analyze them. So first we are going to prepare our ligand.
Sorry, where do we copy the link and how we do it?
So you go to File, Preferences, and Set. Is that, or from where do we copy? So you go to here.
Yes, but then in Set there is a window. Where do we have to
File, Preferences, Set. there is a window here in the third one. It says startup directory. Can you see this window of me?
Yeah, thanks.
Okay. So here you copy and paste and make sure that is that one. And make default, and then you can close it. Good, thank you for asking. So then you go to Ligand. We're going to do Ligand input, open. And because we have set up our default directory as this one, it's going to take us directly there. So indasol, and then you click. It's not going to be there because Autoduct reads only PDB Qt files. So you have to go here and do all files, and then now you're going to see all the files. So you have to open indasol. So you're gonna open it there, go to indasol, select it, and then click open. Now it's going to, a window is going to pop up that says warning that they added some charges, and then you're gonna click OK, that's fine. You can make your own ligand. As I mentioned earlier, you can modify this one, but this is just an example that we're going to start. So this file, we have to convert it into a Pdb Qt file. But first, I want to show you that which bonds are rotatable. So you go, in order to see that, you go to Ligand, torsion tree, and you see detect root. Oh, no, so Ligand, torsion tree. Sorry, it's Ligand, torsion tree, and choose torsions. By doing that, a new window is going to pop up and has the color codes for the bonds that are rotatable or not. In this case, if something is green, this is not green. If this shows as a green, that means that this molecule is going to rotate. But this is a very small molecule that this aryl ring and these other rings, they are not, they're in a fixed position. So in red means that they are unrotatable. So you can see it there. And this is just more for information. So there are 0 rotatable bonds. So you click done. And now we are going to save this file as a Pdb Qt file. So you go to Ligand, output, and save as a Pdb Qt. You click there. And now you can save this file. You can type there indasol. You can name it whatever you want. It's better, again, do not have spaces. So .pdb qt, and then save. Now, just to make sure, I have now. Why is this not showing? I have now indasol in a Pdb file and indasol in the Pdb Qt file, right? So we have, okay, good. So we have done already the first part. I'm gonna go to the presentation. So far good. We have prepared our ligand, defined the torsion angles, and save it as a PDB QT file. Somebody has a question. Could you please repeat the path of the rotation? Yes. Let me go back there. I'm going to share. So I'm here in, so you go to Ligand, I'm in Autoduct Tools. You go to Ligand, torsion tree, and choose torsions. And a new window is going to pop up, and it's going to tell you which are rotatable bonds or which are not. And pretty much this molecule is in red. So this is a not flexible molecule, it's rigid. And when you do the docking, you will see that the molecules doesn't rotate. There are not two parts like that can rotate like this. It's only going to rotate like the entire molecule all together, right? It's a small molecule. But you can add different parts to the molecule that can rotate, right? So that's important to define. So you click done, and then we do ligand and output. Is that good? Ana Lilia, yeah, okay. Stop me. It's better to stop me now than later tell me I missed the first part. So okay, now the second part. So so we went through all this first part, preparing your ligand, right? And here I'm putting in the presentation. You can go back and you can do it for you. This is exactly what we did. We set up the default directory. I say make sure to not have spaces, right? Because otherwise it's not going to work. Sometimes when you're running your docking experiment, you will find some errors, and it's going to tell you probably that you cannot find the name, you cannot find the file, and this is probably because you have spaces. It has happened to me, so no problem with that. I'm just trying to save you time. And we did that. So everything is in the presentation. Now, number 2, we are going to prepare your receptor or your protein. The one that you are going to, you prepare your ligand, and we're going to dock the ligand to the protein. So you have to remove the ligand, because from the PDB file, this protein comes with your ligand, right? And comes with other molecules that somebody asked about the glycerol. And then you have to add hydrogens, and then we will save this as a PDB QT file. All right, so this is the workflow. So I'm gonna go now to the Autoduct Tools. And for the people that have not installed it, I'm sorry guys, but Valentina and I don't know the other people, just try to pay attention for now, and I want to be here all the time. Like the next week you can ask me anytime, or if you guys want to meet later, I can do it. So I'm gonna be available for you guys, so no problem with that. So okay, good, you installed it. So I'm gonna go
We have a question in the chat.
If our molecule have rotatable bonds, we will have to modify something. No, it's just you can modify them if you say, for example, I don't want this molecule to rotate in this angle. Only if you have that. For this purpose, for now, no. But yes, you can define the torsion angles. So I'm going to go to Autoduct Tools, but I want to. trying to find. Okay, here. Okay. So now I'm here in Autoduct Tools. So we already prepare our ligand. We can hide this ligand, and there are buttons here. These buttons. Autoduct Tools is a very similar program to PyMol, so you can rotate your molecules with your left mouse, or you can with your right mouse you can move it around. And if you have installed PyMol in the right panel, you can also decide to hide something. So we're going to click this ligand. We're going to hide. So you're doing it there, right? So we're going to hide it, and now we're going to prepare our protein. So I have a question. Someone is in the chat. Okay, you are answering there. Okay, great. So now to do that, we're going to bring our protein. So you go to grid, macromolecule, open. Again, it's going to take us to this directory, but we don't have it there. So we have to open all files, because our 2VTA file is in a Pdb file. So we're going to open that one, select it and open. And this is your molecule. I'm gonna make this bigger. Are you seeing this warning? Do you see this window? Okay, so this is telling you that contains 182 non-bonded molecules. And what are these molecules? There are water molecules that are non-bonded. Because this protein was crystallized with water molecules, they are there, right? So we're going to ignore this. We're going to click this one, okay? By doing that, it's telling us, because Autodoc needs to read PDB files, it's telling you that you have to save this file as a PDB Doesn't like to have it a PDB file. So we are going to save this for now as a 2VTA dot PDB in Qt. So you click save. Now it's giving you another warning that there are atoms that have no charge. That's fine. So you're gonna click OK. And that's it. I'm gonna make this bigger. So this is your protein. And you can change the color of this protein by going here. CL stands for color. And you can say by atom type or molecule, or by change. So you can do that. You can play then later. There are other buttons. I'm gonna stick to atom type. In this way, the carbons are depicted in gray. Oxygens by conventions are in red, and nitrogens in blue. So you can do zoom in. So we have to prepare this molecule. How are we gonna do it? First, we have to remove these water molecules. These red dots that are there, so these are the water molecules, we have to remove them. The way that we do it, we go to Edit, Delete Waters. So I'm gonna click there, Edit, Delete Waters, and now these red dots are not there, right? Good. Okay, now we need to add hydrogens. How we're gonna do add hydrogens. So you go to edit hydrogens and add hydrogens. Edit hydrogens and add. By doing that, a new window is going to pop up. That's fine. You can say all hydrogens, that's fine. Just click OK. And now you have added hydrogens to your molecules. These hydrogens are going to be needed for the calculations, right? Somebody's, what is in the chat? Oh, okay, Jesus is asking. Thank you, Jesus. Okay, we removed the water molecules. We added hydrogens. Now we have to remove the ligands because we're going to dock other ligands, right? Marcelo has a question.
Yeah, sorry. What option of for adding hydrogens do you click?
The option, so edit hydrogens and add.
Yes, and then what's okay or
no, just click OK.
Okay.
And that's it. Good. Now this molecule was crystallized with a ligand and the glycerol molecules that I show you that are in the Pdb bank. So because we want to dock any ligand, we're going to prepare this molecule for any other ligand that you want to dock. You want to remove those ligands. Another question: what is the difference between to choose all hydrogens or polar only? Do you know what will be the difference, Jesus?
I believe it should depend on, you want to add hydrogens. I mean, it's better to add all hydrogens because polar, I think it only adds to particular amino acids.
Yeah. Polar will probably only choose only polar amino acids. Yeah.
So remember that you're working with what is called a Pdb QT file. The Q comes from charges.
Charge, yeah.
So essentially, if you pick only polar, it will consider only certain amino acids that have a particular charge. So it's better to add to all of them.
Yep. Thank you. So we have to remove the ligand. So in order to do that, we're going to go to select, to the select tab, select from string, and a new window is going to pop up. And in this window here it has residue. So we have to type the name of the ligand. If you remember, it's LZ1, but you have to add a marker that is a star. In my case, it's in number in my keyboard, and mi teclado es la asterisco. So it's number 8. Question. Alejandro, okay, how you answer? Thank you.
I have one question. How did you open that window?
Okay, go doing again. Select from a string, and that window is going to pop up.
Okay, thank you.
Okay, and then we have in residue, you have to do LZ1, LZ1, y you necesitan poner el asterisco. You have to put the asterisk or the star, sorry. Then you click add. And by doing that, you see now something new, the ligand was selected is here, right? So it has these yellow stars. So I'm gonna click dismiss. I'm gonna zoom on to my protein here. I'm gonna do a zoom in. So the ligand is there. So we don't want the ligand because we already prepared our ligand before, right? So we have to get rid of this ligand. So to do that, you go to edit delete selected atoms. Yes, by doing that, it's going to ask you a warning that if you do that, this cannot be undone. That's fine. We click continue. And something happened. What happened? Did this happen to you guys?
Yes.
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 No new selection. What is? There was a warning. No new selection. Let me see. What else? Everybody. Okay. Yes, everybody. Let me see.
Did you remove the waters from the Pdb file?
We did it now. Let me try again. I did. Yes, we did at the beginning. So let me just start do it again. So let's try again. See, I'm gonna delete this one. Just gonna do super fast here. My computer just got stuck. Hold on, I have to close this one again. Do you wish to quit? Yes. Sorry. Just give me a second. I'm gonna try to open it again. I'm closing Autodocs and I'm doing it again. So let me see. Do you have that problem, Jesus?
Yeah, I'm not following you at this point.
Okay.
Sorry for that.
Okay, so let me do it. Great macromolecule. Just give me a second, guys. I'm just opening doing it here really fast. Let me see. I thought I was but we haven't done it. Just give me a second. Pdb qt. Yeah. I'm gonna.
Gabriel,
Ajá.
a mí no me salió eso. Y no sé si sea por eso, pero al principio cuando añadimos la proteína,
Ajá.
el imidazol estaba como marcado para mí, o sea, estaba verde.
Pero porque no lo habías borrado, no lo escondiste.
Tal vez por eso. Pero después no me apareció lo que les...
Yeah, that's what I'm trying to. Okay, let me see. Let me share. Pero a ti no te apareció, a mí tampoco me apareció ayer, perdón. So let me share. Sorry guys, I have so many screens here and just trying to, okay, here. Trying to find screen one. Thank you, Yuri. Just give me a second. So I'm here again. I deleted the water molecule, selected, delete water. I did that. What else? Hydrogens. Okay. And then select from string. delete. I just did it now and it didn't happen. When I try to save the file, yes, it's gonna Wesley is going to give you an error because we have to remove the glycerol too. I just did it now and didn't it work? I mean, I just tried yesterday like 3 times and also Alejandro says that he's lost. ¿En qué parte vas? So I don't know what happened. Let's maybe close it and open it again. But I just did it now and I was able to remove the ligand. The second.
Could you repeat how do you remove the ligand?
Yes. So let's try it. If the error came to you, I just close it and open it again. But I don't know why is happening that. Natalie is asking, how do you remove the ligand? Let's do it again. So you go to select from a string, and here a new window is going to open, and then I typed LC1 and star. Then you click add. There is no selection because I already removed it, but that's fine. You click add and then click dismiss. So can you guys try again? Because I did exactly the same thing. I don't know why it's giving me that error. The next thing that we have to do is to remove the glycerol. So the 3 letters code for the glycerol is GOL. So you type GOL with the star, type add, and now I'm gonna dismiss that, and these 2 molecules are here. You see them there? They are here, right? There are 2 glycerol molecules. So we want to get rid of those glycerol molecules. We don't need them. How do we do it? We go again to edit, delete selected atoms. When I say yes, continue, now they are gone. Somebody has a question? Okay, yep. Thank you, Jesus. So we have to prepare the ligand. How do we add the molecule, the macromolecule? So you go to grid, macromolecule, open, and then you're going to select your Pdb file. Marcelo? Okay. So everyone else, have you done it? Are you guys there? So we added hydrogens, we remove the water molecules, and we remove the ligands. Those 3 things. I get lost with glycerin. Lost? Angie? Lost? What do you mean? You don't find it, or you have to remove glycerol? How to remove it? So it's same. It is same as for the LC1. So you go to select and select from a string. And then it's the same way that we wrote here LC1. We're gonna type GOL and then add and dismiss. Angie? Yeah. Okay. So I have done it. I'm not sure if everybody has done it. Let me know. So once that we have the molecule ready, this molecule is ready. Now we have to save it as a PDB file. So to do that, you go to grid. No. You go to macromolecule, grid macromolecule, choose. And because I close it and open it again, I'm going to select this molecule and select molecule. Again, I'm going to do it again. So grid macromolecule, choose. Select 2BTA and then do select. And it's going to open a new window. It's going to tell you that has these no charges. That's fine. Ignore it for now. And you're going to save this file. Now you're going to save it as 2bta.pdbqt. So you click, you save it there, and that's fine. Do you want to replace it? Yes, because I wrote it before, so I want to replace it. So that's fine. So it is there.
Yes, but one quickly question. One says, do you want to preserve this chart? With click no. Just
Click no. And probably it's going to give you an error. Okay, so we have your ligand, we have your protein prepared, and now we have to generate your grid maps and doing the Autoduct. So we're going to move to the next part because we are running out of time. So let's move to the next part. The presentation going to. So we have done this second step. We have the ligand, we prepare this one, the receptor. Now we're going to move to step number 3. Everything is here, everything is there. I'm not skipping anything. So for number 3, we're going to go to AutoGrid. The idea is to generate your maps, center the box, and run AutoGrid, and and launch it. So let's do that. So I'm gonna go to Autoduct Tools again. I'm here in Autoduct. So the first thing that you have to do is we're going to generate the grid map for the ligand. So you got to go to grid, set the map types, and you're gonna do to choose ligand. This ligand is not going to be open because I close it. I close I close Autoduct Tools, so I have to open it again. So because it's not there, the ligand is in the sol, right? So I will go to ligand, input, and open, because I don't have it here, right? So ligand input, open, and then I have to select in the sol, the PDB file. So I'm gonna open it there. It's going to tell me something about the charges. Yes, ignore it, that's fine. Now you have here, see your protein is there, and in green is your ligand that we are going to dock. So to do the grid map, so you're gonna go to grid, macromolecule, and choose. Oh no, sorry, macromolecule, set map types, and choose ligand. Okay, choose ligand, and we're going to select indazole. Select ligand. Now has been selected. What type of, I'm just gonna skip some things, but what type of, in this box, we want to know this, if you want to know what type of atoms are being considered for the calculations, you go to grid, set map types, and directly, and a new window is going to tell you that these are the map types. So you're doing these are the atoms that the machine is recognizing for the calculations of the energy. We're going to predict the energy of also of binding. So A stands for aromatic carbons. The N or for nitrogens, there are hydrogen bond acceptors. So these are the amides backbones of the proteins. HT for hydrogens that are hydrogen bond donors, and N for regular nitrogens. So you click there in accept, and that's fine. That's only for your information, no? You guys cannot save it. I'm going to move ahead, Ariana and Wesley, but we can go back and try to help you to fix that. For the meantime, I'm going to try to move ahead because otherwise we're going to run out of time. But I'm sorry for that, but we're going to, I can help you after that. So we have to generate the grid maps. Then the next thing that we have to do is to generate the grid box. So this is the box that I was telling you at the beginning. So you go to grid and do grid box. And this is the box that you're going to restrict where you're going to do your docking. So if we already know this, where is the active site, you can calculate or identify where is going to be your grid box. In this case, I already know because I have done this before. So what we have to do is to change the parameters here in the X, Y, and Z. So in the X, you're going to type 28. By doing that, the box went here, but that's fine. We're going to bring it back. In the Y center, we're going to write 0.69. Now it's here, and in this Z axis, we're going to do 66.23. So now this box is there, right? You can change the size of the box by doing this, how big you want it to be, 40, 50. So you can make it as bigger as you want, but it's going to require more time or more calculation. So I'm gonna do 50. And then I'm gonna do 50 here again. And then 50. So this is the area where we're going to do the docking. Donde vamos a hacer el docking, ¿no? So how are you doing? So once that we have done that, we are going to go to File, save current, saving current. Yep, and it's saved. Now we have to save the grid parameter files. So you're going to do, in order to do that, we have to generate those maps, right? So you go to, as an output, so you go to grid, output, and save as a grid parameter file. All right. So it's going to, you're going to save it here. You can put the name of the ligand, indazole, and you have to, the termination of this file is .gpf, that stands for grid parameter file. So you click save. And it's saved. Now, once that we generated a grid file, we have to run it. And this is where it started getting more, some of the errors start to showing up. So to run the grid, you have to go to run autogrid. And this is why it's important that I told you at the beginning to have those two files, Autogrid and Autodoc. You need to have them in that folder, in the working directory. So we have this one already there. It's going to read this executable file. And you're going to go to, we have already generated this one, indazole.gfp. So what we have to do is to go to browse. And this is the one that we just wrote down, is indazole. And then select it. And by doing that, this second part, it says log file. This is going to generate a log file. A log file en español es una bitácora. Es un archivo que está haciendo las anotaciones de diferentes... todo el proceso que está haciendo, todas las calculaciones. So, this is está haciendo anotando pues todos los cálculos, ¿no? So, this is a log file. And then you click launch, lanzar. If everything works well, this window that is here should stay there for at least few minutes open. If something happens, this window is going to shut down. That means that we did something wrong. I know Ariana and you guys, I'm gonna go back to you later. But this means that this program is running. If something is not working, it's going to appear, it's going to show up in this other tool, in this part. It's going to tell you that there is a message there. There is an error. We can fix that later because that happens to me before, so don't worry about that. So now the Windows closed down, so that means that this works. Somebody is... could you repeat the last part? What part exactly?
The log file name.
To run it?
Yes.
So you go to run autogrid. And we have to select in browse. You have to go here in browse and select this one, right? You click there, and then it's going to generate, by doing that, it's going to generate this other document, other file that is called indazole GLG, that stands for grid log file.
Thanks.
No problem. So we have generated our grid map. Now we have to do the docking. We're going to do the docking, of the ligand to the target protein, right? So how are we gonna do that? Just again, I'm trying to guide you through the presentation. Now we're going to do this last. We are step in number 4. We're doing the Autoduct, right? So the same thing, we have to prepare our docking files using Autoduct. Save this as a doc parameter file, a .dpf, and then we have to run Autoduct, and then launch it. It's similar to the AutoGrid. And this is getting technical, but don't worry if we can go back later and spend more time on that. But I just wanted to show you what is the overall process. Okay, so I'm gonna go back to my Autoduct Tools. So I'm going here, and so the first thing that we work with grid, now we're going to do with docking. So you go to docking, macromolecule, and you're going to select the rigid file. Docking, go to docking, macromolecule, select rigid file. Now the rigid file that you're going to select is going to be your protein, right? Your protein is what you're trying is going to be fixed. So you're going to select your protein 2BTA, the PDB file, and then click open. And that's fine. It's going to open it. Now we need to select the ligand. In order to do that, you go to docking, ligand, and because we have it open there, we have choose. In this case, I know that it's open because it is here, right? So you have to do docking, ligand, choose, and then you go to indasol and select that one, select ligand. A new window is going to pop up. This window is telling you that these are the atom types and other information. That's fine. You just only need to accept it. You click accept. And now that we selected the rigid file, the protein, now we selected the ligand. Now we have to generate our docking parameter file. So the output from those things that we did, you go to docking, output, docking output, and we are going to select Lamarckian GA. That's probably like from my equation or something like that. Maybe Jesus can tell us more later. So you select Lamarckian GA, and you're going to type here. This is the docking file, right? So you're going to type the name of the ligand. So indasol. I want to put underscore doc, and I want to say .punto DPF, that stands for docking parameter file. These are going to be the results of your docking. So we save this file. And now that we save the file, we have to run it. So you go to run, and then first we run AutoGrid. Now we're going to run Autoduct. Run Autoduct. And it's the same thing. It's going to ask you, where are these documents, right? So we have this file, this executable file there. Now we have to run, we have to select this doc.dpf, which is the one that we created. So we go to browse, and this is the, you selected, we just generated that file, right? So you select it, open, and by doing that, again, it's going to generate a docking log file. So everything that we're doing is just the preparation for a run for our docking. And so we go now to, that's is ready. We go to launch. Now this window is here. This window is going to be there for around 10 minutes. That means that we are doing the docking already. The molecule is already running. Exactly. So the molecule is doing these calculations, and is rotating the molecule, is making sure that it's finding the best conformation, and that's it. So if this window crashes or is not showing up, is because we have something wrong. And mainly the main reason that we have something wrong is because some of the files or the directories are not in correct place. But no problem with it's something that we can fix. So we can change the number of calculations. In this case, I'm going to explain that later. We chose a low number. So we're going to get the 10 best docking scores. So this is going to take 5, 6, or 6 minutes. So I'm going to wait for that. And once that we do that, we're going to analyze our docking results. I want to say this: if somebody is already lost, don't worry. I understand. I know it's too much for now. So we can go and watch the video, and I'm gonna stay here for questions, and I can do it again, or we can meet another day in the week, and I can go over you. Also, para gente de español, me puedo reunir con ustedes y lo podemos hacer uno a uno. No hay problema. Incluso even for the Portuguese people. So don't worry. We can practice this later. So the machine is doing this calculation. So let's wait for that. And I'm doing it in my personal computer. So if you have a faster computer, this is going to be done super. If you have a better computer, it's going to be done faster, right? So that depends on your computer. So it's simple in a certain way. Understanding what are the details of the calculation and everything else is more complicated, but it's something that you can do, and I think it's cool. I was telling Jesus on Friday that I know that a girl, 16 years old girl, was playing with doing dockings, and she found like a molecule that inhibit a very important cancer protein. So it was in all the news. I'm gonna try to find that article. So everybody can do it. It's cool because I like that you can find an article and you can say, I know how to use this program, or I can do it from home. So that's kind of cool. It's not like a mystery, or it's not dark magic. So you can do it at home. This is still running, and this is coming the best part, because at least you can see, oh, I can see what is happening there. We're almost done. If you want to do it for the challenge, you want to select your protein. So now you can go to the Pdb, download your protein. I say I want to work with another molecule, and you can do the same thing. Natalie has a question. See, Natalie.
Yes, for example, when we set the grid coordinates, we choose 3 coordinates, but how we can determine it when we are working with other molecules?
Good, excellent question, great. If you download the structure, sometimes they come with a ligand. So what you can do is that you can play in AutoGrid or in Autodoc and try to find it to make it closer to the ligand. Where is the ligand? And then write down the coordinates. So you have to do a little bit more search there. But we can do it later, so that's fine. Like, for example, if you have the ligand there, you can just rotate the molecule. I want to have it here, I want to have it there. You may say, I don't want the box to be that big. In my lab, we have to use a big giant box, but of course that's going to require more computational time. But yes, you have to do that if you want to translate that to another molecule. Good question.
Thank you.
Ya casi termina, ya está por terminar. Está corriendo, todavía está corriendo. More questions. Que si tiene Vector, does Autodoc have a command line to input the scripts? Yes, I'm pretty sure that has. Yeah, everything that I'm doing by clicking buttons. You can make a script and just change the name and do the same thing all over again. You can make it automatic. That's the power of coding, right? So you can just write your script, change the protein, change some some things, and you can do it all over again. But this is more visual, so but if you feel comfortable programming, that's fine. It's running, so just it's almost there. Okay, it's done. Do you see that the window just closed down? So that's fine. So now this is done. We have docked our first ligand ever in our life. so you can say that you have docked a molecule. So that's really cool. Now we have to analyze our results, right? You want to see how good is this program or is this predictor. So what we're gonna do first is we're going to delete this molecule. La vamos a quitar de aquí. So we're going to go here, select the indazole that you have, and do the right click, and we click delete, right? Now there is another tab, otra pestaña that says analyze. So you go to analyze and says dockings, or no, sorry, conformations. If you close Autodocs and you want to go directly and analyze it, you have to go to docking, open, and you're going to open the log file. But in this case, we are here, so we're going to go to conformations and play. You're gonna click conformations, analyze, conformations, play. No, oh, what happened there? No molecules. Hold on. What's it? Oh no, sorry. Analyze, dockings, open. Oh, sorry, I didn't load it. Analyze, and then you're going to select the doc file. Okay, we're going to select the indazole doc dot DLG. So we're going to select it, open it, and then now that we load it. So it says it's reading 10 dot conformations from indazole. So you go to play and view to view. So you click OK. Now we do this, analyze, conformations, and play. And this is going to open a new window. You see this new window here? Now, if you zoom in here, now we can see finally the first docking results of this your analysis. I'm gonna zoom into this protein. Where is this is a ball and stick representation, but this is a very busy way to do it. But I'm gonna show you later how can we improve this. So where is our molecule? This is the active site. In this way, you can find that your molecule is here. You see it? Is there. So these are the results from your docking. So you can see there are 10 different, the best 10 conformations. So you go 0, 1 is there. It went down there. 2 now is here. 3 is very similar to 2. 4 is rotating. 5 is slightly changing. 6, 7, 8. 8 now send it back there inside of the active site. 9 is in a different conformation, and 10 is there. So this is the power of docking. So you can look at the best poses, las mejores poses como modelos, the best positions. So you can see that there. Now, something that is very interesting that you want to know is which one is the best pose or the best conformation. So what we want to do is to calculate based on these equations of potential energy that probably Jesus is going to talk more about later or the next week, is that you want to know what is the binding energy. So in order to do that, you go to Analyze, Conformations, and you click Load. And now you can see here that in the conformations is telling you, is ranking the energy, which is the best, the bigger the number here, the lower the number, minus 5.73, the better the molecule of the binding energy. So based on this, you can see that they are very, very close. And based on these positions, you can see that they are very similar. So position 3 and 4, they are slightly changing from side to side. So that can give you an idea that this molecule, that's probably the best position for this docking molecule there. Now, this is how you analyze your results. This is how can you do it. Now, something that I mentioned here is that this is a very, I'm about to finish in 10, 15 minutes. So something that I wanted to show you is that you can change the representation of the ligand, because this is a very busy. So you can go to the ligand and you can change it there. In my computer, it's not showing, it's just doing that. But this is a very busy representation. What we want to know is to find the active site. And based on the structure or in the articles that you find, we can clean this representation. We can clean it just to look at the residues from the active site. So let's do that together so we can have a better idea of what type of interactions are happening there in the active site. So in the way that we do that is very similar than when we selected the ligand. So you go to Select and then select from a string. And here we are going to type the residues that are from the active site. I have already written down those, and these are in the presentation. So I'm just gonna type them down there. You can follow me, or you can look at the presentation. So in slide number 59, we have I'm gonna type them down here, the residues. So you have to type lysine, L-Y-S, lysine 33. I'm gonna add it, and now it's being selected here, right? And I'm gonna keep doing that. So it is there, is highlighted with yellow stars. So I'm gonna keep doing that for the other residues. So I did it for lysine 33. I'm gonna do it now for phenylalanine, PHE 80. I'm gonna add it there, and I'm gonna keep doing the same thing. Now I'm gonna add GLU 81, glutamate, GLU 81. Add it, is there. For phenylalanine 82, PHE, add. Now I'm gonna do it for leucine 83, LEU, add. Histidine 84, HIS 84, add. Glutamine 85, so is GLN, add. And aspartate 86, ASP, add. Two more residues, LEU, leucine 134, add. And then aspartate again, aspartate 145. And I'm gonna add it. Now you have seen that all of these, I'm gonna click here, dismiss. All of these are here selected, right? So these are the residues from the active site. We are going to put them in the dashboard. So we're gonna do that. We're going to go select, add selection to dashboard. So in select, add selection to dashboard, and this is going to put it here in the dashboard. So I'm gonna do that. It's going to ask you to put a name. I'm gonna put active site. Active site. I'm gonna click OK. And now it's there. Now what we have to do is to delete, to hide your protein. So if we click here in 2VTA, I'm gonna hide it. Now it's not there. Now you have to bring your active site residues that we selected. So we go here to active site, and we're gonna click this green button, and voila. If you want to hide them, you go to red, and now they're gone, but now they're in green. Now this has a weird, it moves in a different way. So if you go to this black, so if you go to this, to the black area and type RNC, you can now rotate this molecule like freely, like we were doing. Now this is a better way to see the active site, because now by eliminating the other residues, now you can see your docking results. Now what we're gonna do is go to Analyze, Conformations, and open our play. Now you can see that just by focusing only in these residues, you can move around. Look at this. See, now you can see which ones are closer or far away. So for example, you saw that post number 8 went inside of the active site. So maybe that's telling us that this is not the best conformation, right? Because 9 brings it back. So now you can see that this is a much better way to analyze your docking results. So something that you want to do, because Autoduct is it's a docking program. It's not the best. It's not a program for protein visualization. if you can apply what Carlos posted with PyMol. So you can export these files. You can select the best pose, this position. Let's say that we're going to select it, and we're going to go to File and Save and write down as a PDB. All these files are in PDB files, right? So we have to export it as a PDB, and then you can open this in PyMol and try to play with it. Now, I'm gonna bring back the presentation. And I have shown you here in step number 7, number 6, I show you how to, in 5 and 6 and 5, I show you how to view and evaluate your docking results. This is exactly what I said. It is there. This is what we did. We only selected these residues. I mentioned that if you type RNC is there, you can center this molecule. So everything that I say, it is there in the presentation, and it is going to be posted in the video. Other thing that you can do, but I didn't try this time because the last time that I tried, my protein crashed. The screen just crashed. So if you click here, select MS, molecular surface, this is really, really, really cool, because now you can see also how this molecule rotates. If you have a very nice computer, you can do it, and you can see how it's moving around the active site. So this is really, really nice. But at the same time, you can export these results and use it and open it in PyMol. So step number 6, I show you how to export these files. It is here. You can do it in exporting to the Pdb file, right? This is wrong, right? And now, if you open the article the ones that I'm sending you, this is where everything comes down to this figure. This is the crystal structure for CDK2 with indazole bound to it. And and then this is the crystal structure for this other fragment, and this is the docking result that I did. So you can see how this is a very powerful software that allows you to make to predict the binding of a molecule, and this can be used and is done in pharmaceutical research for the development of new drugs. And with that, I just want to finish because there are other resources here. There are tutorials, and I'm gonna be available for you guys all the time. There is an article that I can post that also, if you don't want to, there are softwares that do. This is a game. This is a workshop from the Swiss Institute of Bioinformatics that also gives you an idea of what is the process of drug design, and you can select your best. You can modify your molecules and playing around with it. And I know that probably you guys have a lot of questions, but I just wanted to. I'm gonna be available for you, and if I know this has been more than 2 hours and we didn't take a break, but I want to finish this. If I'll let you time for questions, but if you guys need to leave, that's fine. I understand that, and of course, you're not going to learn it in one way. You have to keep practicing, right? And you have to do it with your own molecules. You have to play. You have to watch the video. You have to look at the presentation. So don't feel bad if you are lost for now. But that's it. If you have questions, let me know. Otherwise, we can meet anytime during the week.